system, if you have if you have an Apple Watch, for instance, that could be automatically shared. So in the past, we shared our health data with doctors and only during visits. But nowadays, you see it much more actively being done. So through our wearables or through our blood pressure monitors, for instance, this one has an app, um, and through your smart scale, for instance, it also has an app. Um, Now, luckily for the scale, you can just use it as a dumb scale, and the blood pressure monitor, you can also use it as a dumb scale or as a dumb device. But if you install the app, you are actively um, sharing your data. Um, so in the future, what we are expecting to see is that this data will be shared with your doctor, hopefully upon request, of course, or upon consent, and your doctor can actively monitor your well-being. Now, the current problem at today's healthcare is reactive. Data exists, your smartwatch exists, um, but we hardly use it. The data is actually being wasted, because what do we use a smartwatch for? We use it to see how many steps we took, to see if our heart rate is up when we go up to Penang Hill, things like that, and that's all nice and fun to share on Facebook. Like, I did this many steps, or I cycled around Penang today and I did 20 kilometers. Those sorts of things, but they're not helping you, to be honest. Um, um, Hey, your like I said before, your data is wasted. The doctor doesn't see it, and unless you actively go to your doctor and tell him, I checked my blood pressure over the last 3 months and I've seen that it's up. It doesn't help your doctor. Um, I'll go more into that later. Um, and then another problem is aging population and loneliness crisis. Um, uh, there are studies that say that there's a higher mortality because the elderly people are um, feeling lonely. And they often don't have a partner anymore. They see their children and grandchildren less and less. And there have been studies that say that this is connected. Now, with research, there's also studies, most likely, that say it's not connected. But um, yeah, I personally believe that it is connected. Um, so healthcare today um, is much like checking your bank account uh, after you find out that you're bankrupt. You have symptoms, and you go to a um, um, sorry, you go to a healthcare practitioner after you find out that something is wrong with you. So we currently have reactive healthcare. Um, so there is some kind of trigger that makes you go see a doctor, go to the hospital, those sorts of things. So the trigger could be a routine checkup. It could be you're feeling unwell, or for instance, something has happened in your family which made you doubt your own health. you might think, oh, something is might be hereditary. I'll go see the doctor, and I'll have him check if I might have the same thing. I know that that's happened to me. Um, um, and
Sorry, Norbert, do you have slides?
am I not sharing?
No, you're not. So that's why we don't know. We can't see your slide.
Okay. Wait. I'm sorry. Which one is it? No, 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 no. This one. Okay. Is this big enough, or do I need to make it bigger? Can you see it now?
Yes, very clear.
Yeah, big enough?
Yeah, yeah, can see. Yeah, clear.
Okay. Sorry about that. I thought I already shared it. Um, thank you for the comment. So, like I said, we are currently in a reactive model. So the trigger could be, like I said, your something happened in your family, and that is um, why you went to the hospital. Or it could be your fitness tracker told you, like, hey, um, um, something's wrong. Your heart rate is up when it shouldn't be up, or yeah, like I said before, you have one of these, um, and you notice yourself that your blood pressure is up. Um, so the technology itself is not the current limitations. Um, and I say technology um, because not all devices are created equal. There are some that are quite unreliable. There have even been some that just give fake readings. I recently saw a video about someone who does a lot of checking on um, uh, I'm sorry, the blood sugar readers, and he found one that just gives random readings because he wears two of them, um, and he said this one is just basically telling you that that everything's fine, even though they're not. Um, so always look at them. On the other hand, my own cardiologist was very happy when I told him I bought my own blood pressure meter because he said, when you test your blood pressure at home, you test it in a most of the time uh, less stressful environment than when you come over to the hospital. And he even told me, even if you have a machine at home that is um, off by 10%, it's probably off by 10% all of the time, which means that even, and in my case, he said, 10% for you is still a problem. Um, and he said, I'd rather have it be 10% off all of the time then you come and see me, and now all of a sudden we have a spike of 10%. Um, um, he said, because the lowest day matters more than a stressed reading. Uh, and most devices are actually really good. Um, most heart rate devices, for instance, are actually really good at doing that. Um, yeah. So so what kind of data do we have at the moment? Well, like I said, I have my smartwatch, which tells me my blood pressure, not my blood pressure, my heart rate. I have a blood pressure monitor at home. I have, well, everyone who's been alive since COVID has a blood oxygen meter. Um, they were basically giving them away. I have I forget the name, a glucose monitor. That's the name. And a scale. Um, and that's about all the things I have in my home. Um, and that's, on one hand it's helpful, on the other hand it can be problematic, especially if, like me, you are not brand loyal, because, for instance, my smartwatch is a Garmin, my blood pressure monitor is a Omron, I have a Xiaomi scale. um, uh, so I need, for those three alone, I need three different apps. um, Now my glucose monitor had an app, but the developer, or the company, decided to pull it from the store, so that doesn't work anymore. Those are all things that happen, and the blood oxygen meter is a dumb device. But what if these devices could all interconnect and send their data to your practitioner? Um, that is something that we are hopefully going to see. And you already see that apps are starting to interconnect where they previously didn't. Because, well, for instance, Garmin apparently saw the light and initially thought everyone's going to buy my scale. And now they are also connecting to other apps and reading the data from there. Um, so you have like one entry point. So we are looking at a more proactive healthcare. So a proactive healthcare removes the need for a trigger. Um, the same data is collected that I already mentioned, um, but and it can be sent to your healthcare practitioner. Um, so instead of a single snapshot, your healthcare professional gets the entire view, and he or she gets it in a non-stressed environment, which is especially important for things like your heart rate, or sorry, blood pressure. And also heart rate in some instances. Your blood sugar level it's nice to see it over a 24-hour clock, and not just the moment you walk into the doctor's office and you haven't eaten for 10 hours. So this will enable healthcare providers to give better treatment and guidance, and they can tell you you need more XYZ at this um, time, for instance. Um, let's see. Detecting anomalies, an increase of your resting heart rate, poor sleep, reduced activity can mean many things. Now, if you look at this logically, this sounds great. Why haven't we done this forever? Because nobody's looking to pay their healthcare practitioner 24/7. Um, um, there are a few people who have the money for this or the power for this, but most of us don't. But if we enable AI on this, AI is very good at analyzing the data and seeing discrepancies in your data, and it can then forward the discrepancies to your healthcare provider, so they get clear insight and early alerts. Now, of course, these tools that I have at my disposal are not 100%, and they're not. They won't give you information about everything, but they can help early detecting. Um, um, so reactive healthcare boils down to you feel sick, you go to the doctor. Proactive healthcare, the system tells your doctor or you, hey, go see each other. Something needs to happen. Um, yeah. So, will we be seeing an AI doctor soon? Well, not a robot. That that might take quite a while, actually, because this is what a lot of people think of when they hear AI doctor. They think robot. On the one hand, that would sound cool, but but we're not there yet, and I highly doubt we will see anything like this anytime soon. And we will have AI to assist doctors. We will have robots to assist doctors, um, but and that is because it's not because of the lack of technology. Um, it's mostly, in my opinion, because of lack of accountability. Um, if an AI makes a mistake or a robot makes a mistake, who's responsible? Is the hospital responsible? Is the software developer responsible, or is the manufacturer of the robot arm or whatever responsible? And of course, beyond that, which is especially relevant nowadays, geopolitical dependencies. Um, if someone decides he doesn't like your country anymore, what happens if he turns off the AI? So the idea of a fully autonomous AI doctor is, in my opinion, not happening very soon. But there is already a shift. There are already hospitals out there using AI to assist doctors behind the scene in data analysis, in decision support, not decision making, and augmenting healthcare. And there have been operations done over the internet, which were hundreds, if not thousands, of kilometers away from each other. Uh, so AI is very good at pattern detection, at triage, and recommending support. Um, but it will not replace human judgment yet, and it cannot handle ethical decisions. I know that previously for car manufacturers, for instance, with autonomous driving, there was one question and it said, so if your car is autonomously driving and it has to choose between saving the life in front of the car or saving the life inside the car, which one does it choose? And that's a very well, uh, negative slash negative in autonomous cars. Hopefully, in healthcare providers, it won't be that negative. And it is rare that a doctor would have to choose which one of the two to save. It does happen, but luckily not as prevalent. So yeah, AI won't replace doctors, but doctors using AI will or might or replace those who don't. So I just said there are already healthcare practitioners that use AI. There is a real world example that is Mediverse. And Mediverse is actually a Malaysian platform. Um, uh, as far as I know, it's 100% Malaysian. It was designed in Malaysia, built in Malaysia, and it's Malaysian backed. I actually know one of the doctors who backed this. So this is, as far as I know, 100% backed by doctors. So not just by a venture capitalist or whoever. They actually said no to the venture capitalist and they decided to do it themselves. Yeah, Malaysian local. And one of the, for me personally, important things that it is not so much a Malaysian thing, but a local thing, is that a local platform like this knows more, hopefully, about local laws, local people, and local issues than something you buy off of the shelf from another country. Um, uh, yeah. So, elder care and loneliness. So this is my own grandmother, my Oma, as we call her, and she had dementia, and it progressed quite fast. Um, she had um, um, she had a stuffed bunny who was called Snuffy, and she cared for it, and she thought it was real. Nobody was allowed to touch it other than her. You couldn't even pet it because of what happened previously in her life. Now, why do I share this? Because globally, the world is turning gray. The grayification is happening all over. Everyone knows it about Japan, but it's happening nowadays almost everywhere. So birth rates are declining, and with that, um, elder care is a very challenging thing. Um, Not just physically, but also emotionally. Um, care, Caregivers, they deal with frequent loss, um, which is uh, uh, which is very difficult for them. And in most cases, they have very limited support, which so on the one hand you have something that is very demanding, um, and on the other hand it's not very appealing, um, because it's a tough job, both physically and mentally. Um, so it's difficult to scale. Um, um, Now we have had electronic pets before, so that is also nothing new. Um, and electronic pets have been mostly, of course, used for youth, to keep them busy, and we know that they worked. Tamagotchi, in this instance, um, it was a major craze in the I'm going to guess early 2000s. Um, but what if we take away the toyification, the gamification of it, and turn it into something that can help people with dementia, uh, um, can help them feel less lonely, can make them feel calm. And the Tamagotchi, it reacted to a button press, and it had a timer. So every day at a certain time of day, you needed to feed it, you needed to play with it, and if you didn't do that, it gets sad. And I believe they even died after a while, if you didn't play with them. So if this works with children and with young adults, why can't it work with people with dementia, or people in an old folks home, or assisted living? Um, So if we create this in an artificial intelligence, not the Tamagotchi as it is, but something to help them, to get them to talk, to get them to interact with, um, um, yeah, that might help them. Now, of course, it is a difficult question, because you are, or an ethical question. Are you helping or are you misleading? And yeah, there's no simple question. Um, sorry, there's no simple answer. So the question is, how do you use an AI responsibly for people who don't know that something is an AI? We're already seeing it. You go to 90% of the websites nowadays, you try and file a complaint, you're getting an AI that's most of the time telling you it's not an AI, but it's quite obviously an AI. Um, yeah. Um, and then we have personalized healthcare, personalized wellness. Now, there are apps like Headspace or Attached, um, that provide uh, guiding for meditation, sleep, stress management, these sorts of things. Now, most of them say it's tailor made for you. Uh, I think we all know that it's a predefined set, and there might be some learning in it. Um, Basically, a similar way like how YouTube learns your preferences. You clicked on this video once, and so most likely you will like this one also. Now there are many more apps like this, but I chose to take these two out. The good thing is that the barrier is very low. eh? Um, People, especially men, they go to the doctor very sparingly. Um, Basically, as long as my arm doesn't fall off, I'm not going to the doctor. That's kind of what it boils down to. Now, an app like this is very low barrier. You install it on your phone, and it tells you something. Most likely, most of you have asked Google or asked some AI before about some health related issue. I have a rash here. I have a this there. I have this hurts. What could it be? Um, uh, yeah. Um, so apps like this may work for you, or you may be more inclined to an in-person or real life uh, interaction. Um, so this is more my let me check. This is more my field, risks. So I'm from a IT background and a security background. So the first thing I start noticing is the risks. So we have on our phone what happens once, not if, but once the data gets breached. Because nowadays you see everyone's being hacked and everyone's losing their data, even the big people. And it's happened to Microsoft's cloud, also, it's happened to Amazon, it's happened to all the big guys. So why won't it happen to yeah, Garmin has also been breached a few years ago. um, um, and misuse by, for instance, insurance companies or employers. Now, luckily, Malaysia has quite strict rules about who can access healthcare, health data. Um, but that doesn't mean that the healthcare provider, or sorry, the insurance company doesn't abuse it, because there are certain um, loopholes. Um, Basically, if you want your insurance company to pay for something, they they basically need to know what happened to you and what was the outcome. And so that's actually very risky. And that's another thing. Like I said before, Malaysia has very strict rules about this sort of thing, um, but the enforcement of the rules is um, I'm going to softly say non-existent. Um, so we need to start asking ourselves and our healthcare providers, um, what data are they logging? What data are they sharing? What data are they saving, when are they deleting data, this sort of thing. Because a while back I took my mother-in-law to the general hospital, and here in Penang the general hospital is a paper mountain. And they basically went in the back and got her file, and they gave her the file. She's 80 years old, so it's like a phone book for whoever still remembers those things. But yeah, um, that's another one of those things. So they keep this data, but they keep it on paper. And I do not believe that the system is that interconnected that if someone passes away in Malaysia, that data gets destroyed within a reasonable time frame, especially if the data is still on paper. Most likely that data will still be there in 25 years. Um, um, but what I often see, um, what I can see, and I have often seen, is that data classification and data security um, only comes up the moment that companies decide to digitalize. Uh, so, like I said, the data at Penang General Hospital was all on paper, was inside a room, um, and it's just lying there. Anyone can walk into that room and grab whichever file they want. Sure, there might be a lock, but if you've ever looked at how easy it is to bypass a lock, a physical lock, it's literally trivial. And when we start digitalizing, all of a sudden everyone starts to scream like, "Oh, now everyone can access it," which is a valid reason. But I always say, why hasn't that been a valid reason for the last 100 years? And now all of a sudden everyone starts waking up. Yes, it's um, more accessible from the world, um, but it always has been. And the same goes for backups and everything. Your physical paper didn't have a backup. And now that it's digital, all of a sudden, everyone starts screaming. But if that file is no longer available, um, um, uh, all hell breaks loose. Um, so yeah, these are risks that we face, and risks that we need to address. So like I said before, when people say AI in healthcare, they often think of robot doctors. Um, but that's not what's happening. AI is working in the background. It often already is at this moment, and it's helping doctors notice things faster. Um, Scans and images like X-rays or body scans, um, they can be difficult to read, and some doctors have to go through many of them a day. AI has already multiple times detected, for instance, cancers in certain cells that human doctors did not spot, but the AI was able to spot. Um, of course, anyone can make mistakes, so it's not to say something negative about these doctors. The AI can also make a mistake, but see it as an extra tool that can help doctors. Um, so it won't be replacing doctors, but it's an extra set of eyes. Lab tests, similar. The doctor is most of the time not the person looking at the microscope. It's someone in a lab that is looking at these things 100 times a day. And when an AI can help narrow things down, um, yeah, it's very helpful. Um, and again, things like your smartwatch, if it detects something in your heart rate and can trigger an alert. I know, for instance, my Garmin watch. If it detects an alert and I don't tell it like, "Hey, I'm actually fine," it will at this moment send an alert to my wife or whoever I put as an emergency contact. Um, it will notify my location and say like, "Hey, something is wrong." And in the hopefully not so near future, this won't go to your wife or your spouse or whoever, but it will go to the emergency services. Similar like how cars nowadays work. If you've been in an accident in certain cars, the car itself will tell you, "I've detected an accident. Uh, um, I'm contacting the emergency services." Um, and you can override it if you think like, "I'm fine, I don't need," or it's an invalid. It wasn't a real accident. Something else happened. Um, so yeah, these things already exist, and hopefully AI will help out. Um, uh, yeah. Um, and then again, trust. Um, we have to be able to trust smarter healthcare. Um, um, we don't trust every device on the market. Um, there have been in many devices. I personally don't know any medical devices that leak patient information or user information. But for instance, the so-called smart doorbells, smart cameras, and everything, CCTV. Um, uh, Many of them have leaked data to the suppliers, which they said they wouldn't, but later were found out that they did. Um, so, yeah, we also need to be careful with this for our medical devices. Like I said before, luckily Malaysia has stricter rules, so it won't be, it shouldn't be that big of a problem here. But in countries like the US, yeah, that can be quite a big problem. Um, yeah. So that with that, I come to the end of my talk. I didn't see any questions in the chat.
We haven't reached any of the questions yet. So anyone has questions for Norbert? Please ask the questions in the chat and we will address it.
Please note, I'm not a medical expert, so don't ask me your medical questions.
Any questions? So, okay, so I have one. So Norbert, do you think that, with the Internet of Things, that all our data will one day be automatically collected and sent to the hospital, sent to our physicians, like in a very near future, based on your research?
In the near future, I would say definitely not. Because like I said, it's the ethical things that we need to worry about. Wait, I think I'm still sharing. Let me, wait, am I still sharing? Am I still sharing?
No.
No? Okay.
No, you're not sharing.
Okay.
Yeah. So
No,
you were
it's the ethical things that that we need to file out first. First of all, automatic sharing, I don't see that happening. Um, if that starts happening, many of these companies will have issues with European Union, was extremely strict rules against sharing this sort of data, especially automatically. Countries like Australia, they won't allow this sort of thing. There are more lenient countries where they might get away with this, but let's see. But no, not anytime soon, and not automatically, at least. You will require user consent, and the Malaysian PDPA is actually very strict about this. You need user consent to share this sort of data.
okay. Thank you.
And even if you would get this data, it would still be very difficult to actually do it legally, in my opinion, because my Garmin watch, for instance, it now sends my data to Garmin. So I'm basically, by buying this device, I'm kind of accepting that my data is going to Garmin. But then Garmin would have to have some kind of contract with a kind of centralized Malaysian doctors association. So I would see that as a sort of Bank Negara Malaysia, but for doctors. I think there is something like that usually in countries.
Well, we have our own medical doctors, HIPAA, and which is like a protection, for doctors, patients' confidentiality. But of
Yeah,
course, we are facing problem now because in the transmission, even though there's confidentiality, is a transmission of data.
yeah.
Charlene has a question in the chat. And the question is, so we can't stop or predict private data leaking in AI world? although AI can, still can pros and cons. So she wants to know the pros and cons of, private data leaking into the AI world.
Yeah. So actually, this is a good question to ask, but I would cut out the word AI, because that word doesn't matter in this sense. Yes, the AI is new, but you can put anything on that. You can put cloud. And the AI here is not the thing that is. Uh, um, 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 yes, it's an addition, but anytime we share data, we should do the same thing. What are the pros and cons? Because anything can leak. Your paper document can leak. Someone can come into your office, snap a picture off of it, and um, uh, put it online. Um, so yes, AI. The thing that makes AI scary in this is that the AI will logically, um, uh, legally or not, be using your data to train itself. Yeah? Um, Now, technically, your physical doctor also does that. Every time you go to a doctor, he or she's a unique human being, and even though you might have the same disease or whatever to the previous patient, it's still a unique opportunity, and you might not have um, um, you might not have gotten this that, in my case, high blood pressure. um, I might have gotten high blood pressure for a different reason than the previous patient. So my doctor might learn from me, the same that AI might learn from it. The scary thing is that your doctor's brain cannot be simply downloaded and sold to someone, but an AI can. But on the other hand, your doctor is already making reports about you, writing it down in the computer or whatever. That can also be downloaded. That can also be sold on the market, if someone's willing to pay for it. Um, so yes, there are pros and cons. The con that I see currently is that there's a lot of AI coming out, um, and not all of them have the correct constraints in them. So what we see, um, well, every 2 months, I think, since recent AIs have come out, is that someone has found a way for the AI to tell or to leak data of other users. It's happened to ChatGPT. It's happened to Google. It's happened to Microsoft. It's happened to everyone. Um, that you just ask the AI a certain question, and it will tell you what someone else has asked. And that is something that you don't see in the old-fashioned style data. You um, you don't ask the Dr. Lenny's computer, oh, who was here yesterday? No, you have to go into the system and go there. It's not a simple question. But like I said before, if you download Dr. Lenny's database, you have it. The same with AI. If you download the database, you have it. Um,
Okay, thank you so much for
yeah.
that very insightful talk. I think it's now 9:10. And okay, so one more question that come in, and this will be our last question for the day, please. Um, Actually, we've got two more questions. If you could
Yeah.
quickly answer this question, Norbert, how do we know which app is secure to protect our
Well,
registered data?
yeah. That
Very
sorry.
quickly.
That's um, you never know. You will never know which app is secure. The only thing you can do is read the license agreement, see what they are sharing and with who they are sharing, and hopefully what kind of data they are sharing. But that's it. There's no secure app because hackers will find a way. Um, Helpful in the near future. AI is already helpful. Um, do we need to fully depend on it? No, absolutely not. If you don't want it in your life, don't do it. It's up to you. You're the king of your castle. Use it if you want. Don't use it if you don't want. But in 2 years' time, if you go to the doctor, you won't have a choice because your doctor will be using it, and you're unlikely to find a doctor in 2 to 5 years who doesn't use it. Rely on AI like ChatGPT for their well-being. Do you think there will always be a gap on? Um, well, the gap. No, there won't always be a gap. The gap is going down faster and faster. And we are noticing now, we are noticing when we talk to AI very fast. You have a chatbot on a website, you ask a question, and I recently had it. I asked a question, and it kept answering the same question, even though I told it like, no, this doesn't work. No, this doesn't work. No, this doesn't work, until I actually told it, like, you've said this response literally 5 times. And then it responded to, I'm connecting you with a human being. So first it lied to me and said it was a human being. And then when I actually told it, you've said literally this 5 times, it said, okay, I'm connecting you to a human being. So yeah, the gap will close, but yeah.
Thank you very much for thank you very much, Norbert, for
I ate.
Yeah. Yeah.
thank you very much, Norbert, for that, for answering us and for being here today. I know, you are, your time is very precious, and I guess, we won't take up a lot of your time. Thank you very much for everyone for being here and for coming. If you have further questions for Norbert, you can contact Persatuan I Inspire, and we will be happy to pass your questions to Norbert and maybe connect you to Norbert as well. So Norbert is actually a cybersecurity expert. So if any of your companies are worried about security breach, I think Norbert should be the person that you'll be contacting. Thank you again, Norbert, and
Thank
thank
you.
you everyone for coming. We'll be closing this talk soon because we are way over time. And we thank all of you for coming. Thank you.
Okay.
Good
Thank you for
night.
having me. Good night.
Thank you and good night.
Thank you.
I'm closing it for everybody. Yeah.